Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care. Hello, everyone, and welcome to a special edition of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's special edition, I had the privilege of sitting down with Caitlin Donovan, the global head of Uber Health, and Kevin Riddleberger, who's the co-founder and chief strategy officer of Dispatch Health. These organizations are relatively new when we think of healthcare, right? I mean, Uber Health and Dispatch Health are both almost giants today, but it's been rapid growth for these organizations. And we learn about their impact in healthcare from the recent past, as well as what's going on in the near future. We hope you enjoy today's special episode, which was taken from our Pop Health Podcast All-Stars live event from November 2021. Thanks, everybody. Enjoy this special edition. So, folks, just very, very privileged and excited to have both Caitlin Donovan and Kevin Riddleberger join us today for our session that really we're talking about organizations that aren't brick and mortar necessarily, but they have the ability to move and be swift in their movement to make an impact on healthcare. So I'd like to initially introduce Caitlin Donovan, who is the global head of Uber Health. Good afternoon, Caitlin in Boston.
Good afternoon, Gavin. So happy to be here, and thanks for including us.
Absolutely. Great to have you. So folks who don't know Caitlin or don't know about her, she does have quite the experience with both companies that you may be familiar with on the, analytics side, which is Bain Capital. And then also on the healthcare side, many of you probably work with CareCentrix. So Caitlin has a background leading different roles in both of those organizations, and she was able to bring that experience and knowledge and expertise over to Uber Health. And for those of you that have been following the show for a while, we've had the privilege of having the past leader of Uber Health on, and we're just really grateful to have Caitlin share from her lens what Uber Health is up to. So we'll get to Caitlin in just a moment. Also want to introduce Kevin Riddleberger, who is a physician assistant by trade and now an entrepreneur. So Kevin started the idea with his co-founder, Mark, back in 2013 with Dispatch Health. And many of you who are across the country may actually have used or partner with Dispatch Health. I know Caitlin's had some interactions with Uber Health and Dispatch Health. So again, Kevin's a PA by trade, and he and his co-founder came up with this idea of how to get the ED in the home. Kevin's based in Colorado, so I can say good morning to you. Can't I, Kevin?
That is appropriate.
All right, awesome. So let's go ahead and jump in to the session. We'll start with you, Caitlin. Since Pop Health Podcast is a podcast, we'd like to ask you, what is your favorite podcast and why?
You know, I love podcasts. They're maybe one of my favorite things to listen to. And recently, I've been listening to the Star Talk podcast by Neil deGrasse Tyson. I thought that I wanted to be a chemistry major when I was in college until I realized I'm much too extroverted to be in a lab as frequently as I needed to be. So I think I scratched that itch a little bit by listening to real scientists on podcasts like that one.
Okay, again, that was the Star podcast, or how do you?
Star Talk.
Star Talk. Okay, great. And Kevin, same question to you. What's a podcast of choice for you?
And I don't know if I'm allowed to say this, but I actually don't listen to podcasts.
Okay.
And, I know we're on a podcast right now, but I just want to be perfectly honest, but what I do usually is read. So I'm kind of dating myself and picking up newspapers and updating myself that way, or reading books or journals is my thing. So, so podcasts, unfortunately, is not something I spend a lot of time on.
No worries. I appreciate the honesty. Do you have a newspaper delivered to your home, or do you pick it up?
I do. Old school, every morning, coffee with Wall Street Journal is my thing in the morning. So love it. Love the feel of the paper in my hand.
Awesome, man. That might be, that's a great memory for me as well. I'm a big newspaper guy. I do digital, but LA Times subscription for me. I'm based in SoCal. So let's jump over to, let's go back to Caitlin. So maybe just briefly, 30, 60 seconds, give everybody an idea who isn't familiar with Uber Health and what you guys do.
Yeah. So Uber Health has been around since 2018. And our mission is to make sure that access to healthcare isn't an issue. So we take the power of the network of Uber independent drivers, but make sure that folks have the ability to access it in a HIPAA secure way. And even if they don't have the Uber app, by connecting patients to our platform through a delegated booking system. That allows a care coordinator, a case manager, a discharge planner to request an Uber on behalf of the patient.
Awesome. And Kevin, I'm going to get to you in a second on Dispatch Health, but just some follow-up questions to you, Caitlin, and some personal experience. So I had the opportunity to work with Uber Assist way back in 2015 when it was just rolling out. And that was when, there was, they actually had an in-person training with some of the elite drivers in Westwood. And so I had the opportunity to do a program with UCLA Health and Uber Assist before Uber Health even existed. So a lot of folks might think they may have heard of Uber Assist, but Uber Health is more than just Uber Assist, right?
Yeah, that's correct. So Uber Assist is absolutely an incredibly important product, just like Uber Wave, that provides additional levels of service beyond just the UberX platform that most of us typically use and are familiar with. What the Uber Health platform does is it allows you to connect a patient to an independent driver that matches the level of service they need. So that might be UberX, that might be Uber Assist, that might be Uber Wave, that might be one of our partners that's exposed through the platform, so that you can connect the patient to the care they need, leveraging the power of our bidirectional logistics network.
Okay, awesome. And I think most folks listen, maybe not most, but some may know what Uber Wave stands for. But folks, that's wheelchair accessible vehicle. And that's just in limited markets, correct, Caitlin?
That's right. So our wheelchair assisted product is available in 20 markets today. And actually in New York City is 70% of all wheelchair vehicle requests by consumers is powered by Uber Wave.
Oh, wow. Very cool. Okay, cool. So let's jump over to you, Kevin. So can you give like an elevator speech on Dispatch Health?
Yeah. Dispatch Health is a tech-enabled healthcare delivery platform that delivers the right level of care to patients inside their home. So got our start back in 2013 and has since have expanded across the country to enable a wide variety of different services, from pre-hospital, ER diversion, care, all the way to hospital level of care or SNF level of care in the home. And most recently bolted on a mobile imaging arm to the business as well through an acquisition to provide mobile imaging to patients inside their home.
Okay, awesome. And I know being California-based, Kevin, I talked about, your presence isn't here yet, but you guys are in a lot of the country. Tell us really briefly kind of where you are in the country.
Yeah, so right now we're in over 25 states. We are opening in California in 2 weeks.
Wow.
So please look out for that in the Orange County area. So kind of a sneak peek there, but had a large expansion on the East Coast this past year, especially in the Florida market. Big in the Northwest, up in the state of Washington, Oregon, Idaho area. Nevada, Texas. We're still growing in the Midwest area, but have had considerable growth, over the years. We're now delivering about, this year we'll do about 350,000 visits into the home itself. That'll extend up to about 600,000 visits in 2022 with our continued expansion. That is some pretty solid growth. Now, your visits. So I think when a lot of people think of Dispatch Health, and myself included, I think of like emergency services in the home. But what you just shared is much more than that, and we'll kind of dig in deeper there. So jumping back to Caitlin, and I know you joined Uber Health after they'd already kind of dabbled a little bit into healthcare. But could you give us some background at, where was that point where Uber's like, hey, we got to jump into healthcare?
I think Uber saw what so many of us in the healthcare industry see, and actually Sachin in the last session mentioned the same thing, where access is a major issue, and more care delivery is happening in the home, just like Kevin's leaning into. And to enable access, especially as care delivery moves to the home, you need more logistics. I think Uber saw that clearly back in 2018, which is why they entered into the healthcare space. And what we're doing today is really to help accelerate that migration of care from an inpatient setting to an in-home setting by making it really easy to coordinate the rides back to appointments, the delivery of prescriptions, the delivery of food, frankly, as you tackle more acute patients. And really excited about the impact that we can make in that space.
Yeah, you mentioned the food delivery. I did Uber Eats for the first time recently. I think I was actually in Boston, where you're from, when I experienced that. So you mentioned, to easily make this accessible. So this is going to be for both Kevin and Caitlin, but let's start with you, Caitlin. Easily accessing services at this point in our world in general has become more challenging with the workforce shortage, right? So this is from, entry-level type driver folks all the way to skilled physicians or nurse practitioners that might be on the dispatch side. So let's start with you, Caitlin. I've reused Uber recently and it wasn't bad, but I have noticed a little bit of an uptick in wait times and even like a warning like, hey, there might not be drivers available. Now that didn't happen. I was able to get drivers. But can you tell us how you're addressing this? And keep in mind our audience, many of them do use Uber Health, particularly for patient pickups, whether it's an inpatient setting or outpatient setting round trips.
Yeah. I think healthcare is a little bit different than any consumer product in that you can't take a less than 100% SLA as acceptable.
And really quickly, Caitlin, SLA, service
level agreement. Exactly. So if we're a patient, we need to make sure that we have the same access as the person down the street as the person in a different state. And the way that Uber's trying to solve that is in two ways. One, you're spot on about the pandemic has accelerated shortages across the board, whether that's drivers, physicians, nurses, et cetera. And so one thing that we've been doing is leaning into how do we make sure that our driver base is coming back, that our wait times are acceptable. And our driver base has grown 65% since January and 25% since July because of the investments we've been making. And our wait times on average across the nation are at 5 minutes.
Oh, nice. Okay.
Which is great. But that only solves a piece of the problem, right? So we recognize that Uber Health is only a piece of the care team. And we are intending to enable administratively friendly access by connecting with caregivers, right? So when Uber's appropriate, when the wait time's acceptable, when you're in an urban or suburban area, that's great. You can leverage the Uber Health platform and then free up the resources of your case manager, care coordinator, et cetera, to solve for that smaller percentage of the population that may live in the rural area, that may need a higher level of service than Uber Health can connect you to.
Okay.
And we're really trying to solve that by being a piece of the ecosystem, making sure that we do the best we can, and then giving those workflow triggers to allow access for others.
Okay, good. Well, happy to hear about the 5 minutes. That's pretty neat. Now, Kevin, your workforce is a little bit different. So from your lens, how is Dispatch Health addressing this issue, and what are some of the maybe challenges or successes you're seeing?
Yeah, just like anyone in healthcare the last couple of years, it's been a challenge. All of the uncertainties with what we're dealing with right now with this virus, poses a lot of challenges with the workforce, as well. Early on, it was making sure that we were doing everything possible to protect them and make sure that they were safe, going into individuals' homes during the early parts of the COVID outbreak. Now what we see with really anyone hiring clinicians is that it's very, very difficult. We are in a high growth stage right now as an organization, and we are very, very dependent on having great clinicians as part of our platform and as employees of Dispatch Health. So all of our clinicians are W-2 employees at Dispatch Health. So making sure that they have adequate amount of experience and the comfort level of being able to take care of patients, safely inside their homes. And so we've had to compete and be creative around how to attract this top talent onto the platform. Us being a very new, innovative, organization, we've had the ability to be able to attract a different provider that is wanting something new. Being able to, spend time, with patients, the reasons why they gotten into healthcare, in the first place. And so being able to provide that, for them. But it's been a challenge. I mean, it's everyone is fighting for really great, talent. And, whether it be the benefit package or the focus overall in terms of the clinical care. This is something that, us as a country, we need to continue to work together at and to be able to provide resources for individuals, whether it be from medics and techs, all the way up to, physicians, APPs, to be able to provide, different services and capabilities to be able to deliver care.
Thanks, Kevin. And yeah, it is an interesting dichotomy, I guess, between the two of you, Dispatch and Uber Health, and your workforce. So one thing Kevin mentioned was APP. So that is advanced practice
Provider.
Practitioner or provider. Thank you, Kevin. For those of you that may not know, so that's like a PA, like Kevin's a PA, and then a nurse practitioner as well. Are kind of some good examples. So really quickly, I'd like to do a quick poll question. So Amris, if you can queue up the poll. So for the audience, I want to ask you, how has the shortage of medical professionals affected your life or maybe your work over the past 2 years? So that's question number 3. So if you want to scroll down to question number 3, you can see it there. And if you can go ahead and select which of these has affected you or those you serve over the past 2 years. And we'll go ahead and keep that up for another 10 seconds, and then we'll jump in to the next questions that I have. And we'll go over to Caitlin. So Caitlin, you guys, or your title is Global Health. I think so far we've kind of focused on, the US population, but can you touch on what you guys are doing outside of the US as well?
Yeah. What we find is that the intentions of healthcare systems globally are the same. It's to keep patients healthier for the lowest cost. And having a global network of independent drivers as Uber, we want to make sure that we're taking the same best practices that we've seen in the United States and bringing them internationally. The person using the service may look different than the typical user in the United States, but we are seeing other countries leveraging the Uber Health platform to close those access gaps for their patients as well.
Okay, awesome. And then Kevin, I want to jump back to you. We talked about how your workforce, you mentioned their employees. And one of the reasons Uber is able to move swiftly and quickly and people can make their own schedules, there's benefits for the Uber workforce as well, for their being their own boss in a sense. With the employee model, Kevin, there's you may not be able to be as swift, right, with hiring staff, and there's more to it. So has that been a challenge to grow because of the hiring process? And is the employee model something you guys are planning to stick with for now, if you mind me asking?
Yeah, we went and are using an employee model for a reason from the beginning. And it was really to make sure that we could really understand and own the end-to-end experience, making sure that we really understand, who was delivering the care, how we measure, that care delivery and the outcomes, associated with the care itself. How do we make sure that we own, a lot of the education that goes into providing this care in the home? There's not a playbook, out there of really pushing high acuity care safely inside the home. And so we've really had to make sure that, we are spending a lot of time and focus on equipping our providers with the know-how to be able to do this effectively, starting from, how do we identify the right patients up front from a clinical acuity standpoint? How do we get the right, team in an efficient manner out to the home? And then making sure that we are connecting the dots, after that care is performed in the home with the rest of the healthcare, ecosystem. So this is something that we're continuing to focus on. That being said, in, moving forward with, some of the challenges around staffing, there's different ways to be able to look at, staffing, I think, in the future. And so we're exploring a lot of different options right now, as well as partnerships, heading into 2022.
Okay, cool. So earlier in the episode, Kevin, we talked about the different use cases or the different services that dispatch is providing. And in my head, I shared, I'm thinking of emergency department services in the home. Can you walk us through a common use case, I guess, for dispatch health?
Yeah. So, patients can access us in a variety of different ways. And a patient could be directed by their clinician, so a primary care physician specialist, or even a home health agency that, understands and knows about our service. So that individual, whether it be the clinician or the patient, could contact us. We always consent, with the patient to make sure that they understand who we are and consent to that care. But we onboard that individual with demographic and clinical information. The clinical information is very important for us to make sure that we are clinically appropriate to send out that team and take care of them in the home versus being able to escalate them to a higher level of care, such as the emergency department or 911. And so that's something that we do right up front with our technology that we've built to help right size that care. So our care team centrally will be able to go through that software and understand what to ask relative to the patient's age, gender, and chief complaint. We will then spit out a level of risk to determine low, medium, high. If there is a need to be able to screen or triage with a RN or nurse practitioner, PA, or physician, we're able to do that, and the system will identify that and guide them. Once that individual is cleared clinically, we then go through a eligibility check from an insurance perspective. So we will collect that insurance, make sure that this is a covered service before we send out the team or assign the medical team. So we don't want to, go out to an individual's home and not be covered by the individual's insurance and expose them to a larger bill. So we want to do that right up front and be transparent with that patient before we assign a medical team. Once that is all clear, we'll assign that medical team to go out into the home to be able to take care of them.
Okay. And so let's say, for example, I have some kind of issue or chief complaint was the phrase that you used. What's kind of the average or range of turnaround time if I have a it's not necessarily a true emergency or 911? How soon could I get a PA or an APP?
On average, it's about 2 to 4 hours from when they actually request care to the team showing up into the home to be able to take care of them.
Okay, great. And so for our audience, let's say our audience, I'm assuming, is probably anywhere typically from the age of like 20 to 70 years old on average. There's probably some other folks that may be beyond or before that. But this care is not just for older adults, right? This is for the whole gamut. Or do you limit it like children? Can children receive dispatch health services? So
we treat all ages, all levels of income. We are Medicaid providers, all the way up to Medicare Advantage, contract with Medicare Advantage plans, and then we are Medicare providers. We skew pretty heavy in the geriatric space, just based on utilization of healthcare, and aligns with that. But we treat 3 months of age, all the way up to the geriatric population.
Okay, awesome. And then same question to you, Caitlin. I know what's your rider demographic from an age perspective? Like how old does someone have to be to utilize your services?
We aren't the best for the pediatric space just because the parent would have to provide the car seat or be with the minor. So we're good for all adults. Again, like Kevin, just given utilization of health services, we also skew pretty heavily toward the geriatric space, but also do a lot of Medicaid business as well.
Awesome. Now I'm going to ask, I'll start with Caitlin on this one, and we just have a few more minutes left. So I don't know if this applies as much to you, Caitlin, but I want to ask, one of the reasons that I think, and Kevin could touch on this in a second, that dispatch and other in-home or mobility services have really skyrocketed, including telehealth, which is like in-the-home service, is the public health emergency. So many of the audience are probably familiar, but the public health emergency or the pandemic has basically forced Medicare's hand and the other payers to reimburse services that were previously, there was a lot of blocks or speed bumps along the way to get legislation pushed through. Mm-hmm. So I'm not sure on your side, Caitlin, but I'll start with you. Did the public health emergency help you guys with any policy, or were you already set up where you're ready to go when COVID hit?
So we were set up and ready to go when COVID hit, but I do think that what you're describing is the silver lining of the public health emergency, because so many of us have been talking for years about how to move care to the home, how to lead with digital first, and then move patients to the appropriate level of service when there's a trigger to do so. And so much of the policy that came out of the pandemic, coupled with some of the innovations with companies like Kevin's plus Uber Health, among many others, have enabled the execution of that. So, for example, when there's a telehealth visit, patient needs to be brought in to be seen. Uber Health can help bring that person to the in-person care they need, whether it's PCP, urgent care, ED. Similarly, patients in the home has a telehealth visit, needs something delivered to the home, whether that's prescription. I keep talking about food as medicine because so much chronic care comes back to the right diet. Again, Uber Health can help. And I think the coupling of the telehealth that's now reimbursed, plus the in-home care that's now reimbursed, plus the logistics mechanism that connects those dots is really powerful in shaping care delivery for the better.
Got it. I had a follow-up question to that, Caitlin, and I don't mean just clarification. Yeah. You mentioned a drive to the ED. Do you want to clarify like when is appropriate to use Uber to go to the ED versus not? Because I know that's like a touchy area, but our audience is very interested.
Great question. So we as Uber will never take on that clinical risk or devise the clinical protocols of when it is appropriate to leverage Uber versus ambulance to send a patient to the ED. We have received reports from some of our customers that when a patient was experiencing symptoms, et cetera, did not call 911, they have used Uber Health. But again, not taking on that clinical decision-making of when Uber is appropriate.
And I think that's a fair answer, right? I know some people might want more specifics, but you're not in that position. That's not your expertise. So I want to applaud you for a good answer that people might want more specifics, folks, but talk to clinicians on that one. Kevin, public health emergency, we got about 3 more minutes. Would you mind sharing how that has maybe helped you guys deliver your services over this past 18 months or so?
Yeah, we've been on this journey, prior to the pandemic. We've had significant tailwinds of care delivery in the home. If you think about what's really driving all of this pre-pandemic as well as during the pandemic, it's consumer driven, a great deal. And so consumers are used to having convenience in a variety of different services, whether it be meal delivery, whether it be things being dropped in front of their doorstep the next day. Healthcare should be delivered and accessed the same way as well. The other big driver is costs. We know that we in the U.S. spend about $4 trillion in healthcare, but we're not driving significant value. And part of that value is making sure that we are delivering the right level of care at the right price to those patients. And so if we can help with some of the the cost structure with traditional brick and mortar, whether it be in skilled nursing facilities or hospitalizations or ER visits. And we can appropriately do that at a lower cost with better, same or better clinical outcomes and do that into the home. It's a win-win really for everyone. And so that's really what's driven all of this, pre-pandemic as well as kind of skyrocketed, during the pandemic of that access and care delivery into the home. And I think you'll continue to see that post-pandemic. The ship has sailed for a variety of different services that will be delivered into the home. And so it's exciting, moving forward.
Awesome, Kevin and Caitlin. I want to ask Amris, my colleague behind the scenes, and kudos for folks. You can't see Amris, but she's done a lot to put this event together. Amris, if you wouldn't mind shooting me a quick Teams message if there's an audience question, because I know we're wrapping up. And we do want to allow that if time permits. So one thing I'd like to ask at the end of each episode is how folks can keep tabs on what you guys are up to. So Caitlin, I know a lot of folks use LinkedIn. If people want to see what's going on with you with Uber Health, is that the best way to follow you?
Yes, it is. Both Uber Health and I have LinkedIn pages. Okay,
awesome. And then if folks who are listening or watching the recording, and let's say they hadn't heard of Uber Health or they're interested in maybe talking to someone, how would they go about connecting with like an Uber person to talk about Uber Health?
Yes, if you go to the Uber Health website, there's a way to connect with an expert from our team, or feel free to shoot me a LinkedIn note too. I will also respond to those.
Okay, awesome. And then same question with you, Kevin. What's the best way for folks to keep tabs on you and Uber Health?
I think.
Sorry, Dispatch Health. Sorry.
Oh, yeah. So Dispatch Health, you can find more information at dispatchhealth.com. We also are pretty active on different social media pages, whether it be LinkedIn, Twitter. Talking about different expansions of services as well as markets that we expand in to. So that's probably the best way. If you want to contact me directly, whether it be through Twitter, K Riddleberger, or on my LinkedIn profile, feel free to contact me.
Awesome. And Kevin, are you still doing some teaching as well? I know you did some teaching in the past.
I am not doing teaching and mentoring, PA students anymore, but really have pushed and focused more on the entrepreneur type of mentoring at this point here in the local Colorado community.
Okay, awesome. And I guess with you, Caitlin, the reason I brought that up with Kevin is just his background. I know he had done that. Do you do any community involvement? I know you have kids. I know your family. You're running this global organization. You have anything going on the side?
I do. I mostly playing with my kids on the side, and then involved with some very local Boston things as well. But having a 2 and a 4-year-old really takes up a lot of time if you want to see them after work. So
I know those feelings. I'm beyond that stage now, but yeah, a 2 and 4. Very good. Awesome. Well, folks, it's really been a privilege. Caitlin and Kevin, thanks so much for joining us today. Kevin, I'm going to check in with you and see if you pick up podcasts in a few months. But it's nice to know another.
Feel free to push, ones that are great. It was a good conversation with my wife talking about different podcasts last night. So I'm open for good ones.
All right. Sounds good. Well, I know, again, Caitlin's, yours was the Star
Talk.
Star Talk. I wrote down Star Talk. All right, folks. And again, folks who are just a part of today's session, feel free to subscribe. This will be on YouTube on our Pop Health Podcast channel. And of course, you can subscribe on Apple Podcasts, Stitcher, Spotify, wherever you listen or watch podcasts. Caitlin and Kevin, thanks so much. And the rest of the audience will be starting our next session, with leaders from Providence, which is one of the largest health systems in the West Coast in the United States, and with Keck Medicine of USC, which is a growing organization in Southern California. Again, Caitlin and Kevin, thanks so much for joining today.
Thanks, Kevin.
Bye.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.